Hi, I'm Lena.
I'm Mike.
I'm Zach.
I'm Stacy.
Alright, so PTSD has been described as a normal reaction to an abnormal situation. Now, an abnormal situation can be anything from being in a helicopter, being a gunner in a helicopter, and having a rocket hit your helicopter and hearing in your headset, "Hold on tight, boys, we're going down." Then your helicopter crashing onto the ground and you going unconscious and living through it. It could also be something from holding a house, clearing a house out, defending it, and across the road you see a little boy walk across, or come out strapped in explosives, running over to the house that you're defending. You look away, you think back to your home, to your family, and you see your son in your mind, and all of a sudden you're thinking you're not at war anymore. You're back home with your kid, and then you snap back to where you're at, and you see the little boy fall down to the ground, and seconds later, the vest blows up. Those are situations that can cause PTSD that are abnormal situations, and most people would suffer some form of PTSD from witnessing scenarios of that nature. Currently, post-traumatic stress disorder is caused from those types of scenarios, and with the war in Iraq and Afghanistan going on right now, far too many soldiers, sailors, and airmen are experiencing those types of situations and coming home with PTSD. The main form of treatment right now that's the most common is psychotherapy and medication. Antidepressants, loading people up with antidepressants. The amount of antidepressants and psychotherapy that people receive are based off of how severe their symptoms are. Those symptoms can vary from person to person, from having a heightened alertness while they're out in public in a crowded area. They feel very uncomfortable. They get a lot of anxiety just knowing that they're going to be somewhere that has a lot of people in it. Or it can be anywhere from waking up in the middle of the night from nightmares and not getting any sleep, being very agitated with spouses and loved ones. What I propose as not necessarily an alternate treatment, but an additional treatment, is fly fishing and other recreational hobbies. Indiana University has done studies with people who suffer from PTSD, and have found that people that do hobbies such as fly fishing and other recreational hobbies have found that 100% of people that do fly fishing have improved symptoms. Like, their symptoms decrease, their level of agitatedness go down, their level of anxiety goes down when they're going to be in a crowded area or when they're going to be around other people. Another organization called Rivers of Recovery, they're a nonprofit fly fishing organization that takes veterans out fly fishing. They've done an independent study that has shown, just like Indiana University, 100% of participants that were in that study have had long-lasting benefits from therapeutic fly fishing. And just like the Indiana University, their level of agitatedness goes down, their level of tranquility goes up, their level of peace and restfulness goes up. And it's not just for the 3 days that they're fly fishing. Those results have shown to have increased or decreased over a month span. So a month after they went fly fishing, their agitated levelness had gone down. Their level of tranquility has gone up. And we might wonder, why does fly fishing work? Why do you think fly fishing works more so than, why can't I just go fishing? Well, when you go fishing, you're out in a boat, you might reel out a cast, reel a line out, and you reel it back in. Reel it out, reel it back in, but you're not really concentrated on anything mentally. There's no mental stimulation except throwing a line out. But when you're out fly fishing, you're hip deep in water. You're paying attention to the flow of the river. You're paying attention to the movement and the rhythm of your line, and you're focused on getting your fly to hit in just the right spot so that trout will attack the fish or attack the fly. It's mentally relaxing and it's mentally more stimulating, and it keeps your mind off of things that you've gone through and troublesome thoughts that enter your brain when you're just sitting there not thinking about anything. In conclusion, we've discussed what PTSD is, how it affects different people, and an alternative course for treatment that's not medication and psychotherapy. In addition to medication and psychotherapy, fly fishing is a great opportunity and a great outlet for people that suffer from PTSD to utilize. And that's all I've got.